Do they both project online, or does one go to the room and one go to the... Okay.
All right, good evening, everyone. I think we're going to start. I feel like I'm starting a show. My name is Cindy Huber, and I'm the CEO of the National Kidney Foundation of Wisconsin. And every year, we, as part of our mission to create awareness about kidney health, we work with experts, and you're going to hear one of our most favorite volunteer experts tonight to do community education programs throughout the state of Wisconsin. And so tonight, we have people here in the room in Milwaukee, so welcome everyone. And we also have people that will be joining us online tonight. So we have a great volunteer for those of you online, John, and he'll be, he's waving to you right now. You can't see him, but you can type your questions in for our speaker, and we'll read them out loud, and we'll have our speaker tonight repeat the questions from anyone that has a question here in the room. So folks online, we want to make sure that you hear. But I'm really excited. We did this program about 6 months ago and had a lot of interest, and so we want to thank you all for coming out to learn more about your kidney health, but especially about something I don't think people think about, and that's the impact that over-the-counter medication and medications have on kidney health. So 2 thumbs up for all of you to come out tonight to learn more. So I'll turn it over now to our great speaker, Katherine, and let her introduce herself a bit, and we'll get started. But thank you all for coming.
You can talk.
Well, thank you, Cindy. I'm very happy to be here tonight. So a little about myself, a little bit of background on me. So I'm a pharmacist by training. I trained out in Michigan. Go Blue in Michigan. And sorry, you're a Badger fan here. Now I work across the street over at the Medical College of Wisconsin at their new School of Pharmacy there. So we matriculated our first class of students this past August. So now it's very exciting for us now that we get to be training the next generation of pharmacists here in the state of Wisconsin. Today I'm here to really talk about over-the-counter medicines and how they really kind of impact the health of your kidneys. As a pharmacist, I see a lot of patients or talk to a lot of patients. We take over-the-counter medicines, and they take medications without really notifying me as a pharmacist or their healthcare providers that they're taking these medicines. And this can have some consequences. A lot of pain medicine or a lot of over-the-counter medicines can actually they're not that harmless. So a lot of patients take over-the-counter medicines that they're safe to take because they're available prescription, but that is not always the case. And so I want to talk to you a little about some of the over-the-counter medicines that are particularly harmful to the kidneys today. And so those will be the pain medicines, and also so I'll be focusing on those today. So in terms of the agenda today, I want to start off with just discussing why the kidneys are important and what it is exactly that they do in our bodies. And then I want to go into what happens when kidney function starts to decline, what causes it to decline, and how over-the-counter medicines can contribute to the decline or kidney disease from developing. And then finally, I also want to talk about how specifically the over-the-counter pain medicines will contribute to the decline in kidney function, and what we can do to actually prevent this from occurring. And then I also want to, near the end, I want to just throw in a tidbit or a little information about how to safely dispose of medications in your medicine cabinet. So medications that you're not necessarily using, or medications that have that are expired, and how you can safely dispose of them. And then, of course, I'll leave some time at the end to answer any and all of your questions that you may have. If you have any questions at any time throughout this talk, please feel free to also interrupt and ask me questions. I like to make this a little bit more interactive and engaging to all of you. So please feel free to ask questions. If at any time you have trouble hearing, I'd also like you to let me know. So any of you sitting in the back, please let me know if you cannot hear or need me to speak louder. So please let me know that as well. Let me check. Okay. All right. So to start off with the basics, I just want to start off with talking about what the kidneys are. So the kidneys are, just like the heart and lungs, are an important organ in our body. They're shaped like a bean, and they're actually about the size of your fist. And you have two kidneys, one on either side of your lower back. They're located right below the rib cage on your lower back on either side of your spine. And the kidneys have many important roles in the body. And the one that most people are familiar with and is most talked about is that they really help remove waste products from your body. You can think of your body as there's a lot of chemical reactions happening in your body, and they happen 24 hours a day, and they really help break down the foods that you eat, the foods that you consume, into smaller substances that that the cells in your body can utilize and use into energy to keep your cells in your body alive. But your cells can't take in everything that's broken down, or not everything that's broken down can be used by the cells. And so that's one of the functions of the kidneys, is to actually remove these extra products, these extra waste products that develop in the body, and they remove it as waste. And your kidneys are actually able to tell what is a waste product in your body and what's not. And so anything that's not needed in the body is removed in the form of urine. So that's how it's eliminated from the body. The kidneys, another function of the kidneys is that they remove excess fluid from our bodies. We all consume water, as it is a very important part of our body. Over 70% of our body is composed of water. But it doesn't mean we can just drink all day without having some sort of regulation of this water in our bodies. And so that's where the kidneys come in their role, in that they really help maintain a balance of how much fluid is in our bodies. Or if we drink too much, our bodies help regulate this, and they help remove the excess fluid that develops in our body, and they eliminate it in the form of urine. And the opposite may also occur. So if you don't drink enough water, the kidneys will try to maintain the necessary amount of fluid in your body by reducing how much urine is eliminated. And they'll concentrate the urine. That's when you'll notice that you're peeing less, or your urine is a little bit darker, it's more concentrated, and that's your kidney's way of maintaining the proper fluid balance in your body. The kidneys also produce hormones in the body, and this is a function that many people are not aware that the kidneys are responsible of doing. So hormones are substances that act like messengers in the body. So they help control how cells and organs do their work. And the kidneys produce a hormone that is able to really control and maintain our blood pressure. So if our blood pressure drops, one of the things that our kidney does is that they sense this drop in blood pressure, and they're able to produce substances that really increase your blood pressure to maintain this normal, healthy balance. Now, the kidneys also produce a hormone that tells the body when to make more red blood cells. Now, red blood cells are the oxygen carrying component of the blood, and so the red blood cells help deliver oxygen throughout all of our bodies. And we know oxygen is an essential component, or is essential for cell survival. So anytime that there's a reduction in this amount of red blood cells in our body, then what may develop is what we call anemia. And anemia is when your cells aren't getting enough oxygen. And one of the most common symptoms that develops in anemia is fatigue. And so the kidneys are really important in this regards in helping maintain a proper production of red blood cells in the body. Now the kidneys also produce another hormone that really helps maintain healthy bones. This hormone actually helps produce vitamin D in our bodies, and vitamin D helps actually absorb calcium from the foods that you eat, and helps. And calcium, we all know, helps us maintain healthy and strong bones. And so without the proper functioning of the kidneys, we cannot make this proper amounts of vitamin D, and so our bones can become weak and brittle. Now, how exactly do the kidneys work? Well, here's a picture of a kidney. We see that there are these couple of large blood vessels that feed into smaller blood vessels, which feed into even more smaller blood vessels. And these smaller blood vessels eventually become intertwined into these structures that we call nephrons. And these nephrons are the part of the kidneys that is a single function unit of the kidneys. And if you see on these diagrams, you might see these little round blobs. These are called glomerulus, and these glomerulus are essentially a filter. This is where the bulk of the function of the kidney, or how the kidney works. So all the blood that's in your body that contains all of the waste products that needs to be removed from the body, they get drawn down these blood vessels where they get to these filters, these glomeruli, and any waste products that's detected, it'll cross these filters and get to the other side of these yellow tubules that you see here, and that's where the urine is carried out of the body and is excreted as urine. Our kidneys have about 1 million of these nephrons. Each kidney has about 1 million of these nephrons in the body, and they, both of them together, help filter about 45 gallons of blood each day. So they're really efficient, and they're really a workhorse or a powerhouse when it comes to the functions of the kidneys and helping filter all the waste products from our bodies. Now, when the kidneys slowly lose their ability to perform all of their functions, then we call this chronic kidney disease. Chronic kidney disease takes many years to progress to advanced stages. And once any amount of kidney function is lost, it cannot be regained, so it's gone forever. So you cannot get it back. Now, in the United States, it is estimated that approximately 26 million adults have some form of chronic kidney disease, and many people actually don't know that they even have it. And the way you can really find out if you have kidney disease is through a couple of tests that can be done. One of the tests is a urine test, and this urine test checks to see whether there's any protein in the urine. So normally protein should not be found in the urine. Protein is a fairly large substance, and it cannot normally cross those filters, the glomeruli. So if there's if there's protein found in the urine test, that could be a sign that the filters are damaged, that they're not working, and this could be a sign of kidney damage or kidney disease. Another test that can be done is a blood test that can check for a substance that's not normally removed by the kidneys called creatinine. When the kidneys slowly start slowly declining in function, then what happens is this creatinine is the waste product. It slowly builds up in their body because it's not being removed from the blood, and so we are able to use this creatinine to measure how well your kidneys are working, and it helps us. And the way we do that is by using a function that we call a glomerular filtration rate, and it uses the amount of creatinine in your body. Since chronic kidney disease is a progressive disease, it takes time for it to develop. We can use this GFR to really estimate how well your kidneys are functioning. We have divided the stages of kidney disease based on 5 stages. So 1 is the earliest stage of kidney disease, and so with stage 1, there may be some kidney damage present, and you may detect this by some protein in the urine, and you may have a GFR level higher than 90. As kidney function progressively declines to stage 2 and 3 until you get to stage 5, the GFR slowly decreases. And once you get to stage 5, this is the final stage, or what we call end-stage kidney disease. And at this point, the kidneys are considered to be completely in failure. And at this point, it requires dialysis or kidney transplantation for survival. And so this is how we stage chronic kidney disease. So what exactly causes chronic kidney disease to develop in the first place, and who is at risk? The biggest causes are the top 2 ones here, diabetes and high blood pressure. When these 2 conditions are not well controlled, they damage those small blood vessels that I talked about, and they damage those nephrons, and this can eventually lead to end-stage kidney disease. Then there are some other conditions like kidney stones, and there's also some genetic factors that can influence whether one develops kidney disease. But being a pharmacist, and the one that I want to really focus on is this last one here, medications. Particularly over-the-counter pain medications are probably one of the biggest culprits in this category, which I will talk about. So now before I move on, I like to just stop and take a quick poll. I have up on the screen 4 types of general over-the-counter medicines that are available here in the U.S. There's ibuprofen, which goes by common brand names of Advil or Motrin. There's naproxen, which goes by brand name of Aleve. And then we have aspirin, and then we have Tylenol or acetaminophen. Now, by a show of hands, how many of you have at least one of these medicines sitting in your cabinet at home? Okay. Now, how many of you have used these products on a regular basis for pain? Okay. Now, this might be a little hard one. So how many of you know which of these 4 actually has an impact or affects the health of your kidneys? How many of you read the labels on these bottles? So I hear all of them. Any other answers? What was that? You can't hear me. Okay, I'll try to talk a little louder. So, so these are 4 of the most common pain medications that are available over the counter, and there's actually 3 of these that can actually have effects on the health of your kidneys, and these are grouped in a category that we call NSAIDs. So these are the Advil or ibuprofen, naproxen, which is Aleve, and aspirin. And so what exactly are NSAIDs? Yes?
Baby aspirin.
So I'll get to that. So I'll make a point on that. So thank you for your question. So the question was, what about baby aspirin? So I'll get to that in just a moment. NSAIDs stand for non-steroidal anti-inflammatory drug. It is a class of pain medicine that not only relieves pain and reduces fever, but they also reduce swelling and inflammation. So they really work great on any sort of sprains or muscle aches. But these NSAIDs we know can carry many risks. And one of the biggest risks is damage or harm to the kidneys. And the way that they do this is that they actually reduce the amount of blood that flows to the kidneys. I showed you a picture of the kidneys earlier. They actually clamp down on those arteries that feed blood into the kidneys, and they prevent enough blood from reaching those kidneys, and so they cut off the oxygen supply. And so if you take NSAIDs on a regular basis or at even a normal dose, it can actually eventually lead to a loss in kidney function if it's done on a chronic basis. There was actually a statistic put out by the National Kidney Foundation that found that approximately 5% of new cases of chronic kidney disease are actually caused by the overuse of these NSAIDs, of these painkillers. So there certainly is a real risk when in terms of using these medicines inappropriately. But kidney disease is not the only serious risk involved with the use of NSAIDs. NSAIDs also carry the risk of stomach bleeding or ulcers, and they can also increase your blood pressure as well. So a lot of people who are on taking blood pressure medications, one of the warnings on the box is not to, it's recommended not to take it with these blood pressure lowering medications, as they can, it could cancel or reverse the effects of them. Another risk is increased risk for heart attack and strokes, and there's an exception with this in regards to aspirin. So aspirin is unique amongst these NSAID pain medicines in that it actually has blood thinning effects. And so the doses that are used for these blood thinning effects, or baby aspirin you mentioned, is actually lower than the dose that is used for normal pain relieving effects. So somebody who takes baby aspirin, it's usually about 81 milligrams, that is a safe dose to take, and it's not enough to, and it does not affect the kidneys in that regards, or the functions of the kidneys. We start getting concerned when we're talking about these higher levels of, or higher doses of aspirin, so ones that are needed for pain relief. So these will be like 325 milligrams or higher doses of aspirin that can eventually lead to this reduction in kidney function. So those are the ones that we are concerned about. But when it comes to baby aspirin, it's safe to use for your kidneys. Now, I know I asked you a little earlier, but by quickly show of hands, how many of you have ever taken the time to actually read the label on one of these products? Okay, just a handful of you. When you have products, or when you have package labeling like this, it gets really busy, and sometimes it's even a little difficult to read. It's when you have something like this, it really discourages you from actually reading it, especially when you have information that's really buried deep within. So there's a statement in this label that says it should be used with caution, patients with kidney disease. And I don't know if you can see that, but it's located right there in the middle. This is for ibuprofen, and it should not be used if you have high blood pressure, or you should ask a doctor before you use it if you have high blood pressure, heart disease, liver cirrhosis, or kidney disease. Since these labels can be so confusing or so difficult to read, I thought I might create a table for you that kind of distills some of this information down for you, and kind of highlight some of the important information regarding these pain medicines that are available, and some of the key differentiating factors between all of them. We have ibuprofen, naproxen, aspirin, and acetaminophen. Acetaminophen, as I mentioned, is not an NSAID, so it does not carry that typical risk for kidney damage associated with NSAIDs. However, we see at the bottom here that acetaminophen or Tylenol, which is its brand name, has a risk for liver damage. This is usually dose dependent, so the more you take of it, higher doses of it, it puts you or increases your risk of developing this liver damage. And the dose here is over 4,000 milligrams per day. And the tricky thing with Tylenol or acetaminophen is that it's not just available as Tylenol. A lot of stronger pain medicines that are by prescription also may contain Tylenol or acetaminophen. And so it's a combination of if you're taking over-the-counter Tylenol along with prescription strength pain medicines, you may potentially be increasing how much Tylenol that you're taking in, and this may actually increase your risk for liver damage. But the ones that I'll focus on here are the 3 NSAIDs, which are ibuprofen, naproxen, and aspirin, all 3 of which have concerns for not only kidney damage, but they also have risks for stomach bleeding, heart attack, and stroke. And as I mentioned earlier, aspirin actually does not have the heart attack and stroke. It does not increase the risk, it actually reduces the risk, and that has to do with the dosing of it as well. So if we compare the different NSAIDs together here, you'll see that they're fairly all similar. The biggest difference between Advil, which is ibuprofen, the first column, and naproxen, which is Aleve, in the second column, is their dosing, or how frequently that they're dosed. So ibuprofen is usually dosed about every 4 to 6 hours, and then Aleve is usually dosed about every 8 to 12 hours. And so there may, that's the biggest difference between these 2 medications. But they all still carry the same risk in terms of potential damage that they may cause to the kidneys. Now, what if you can't use these pain medicines, these NSAIDs, or you cannot get enough pain relief from them? What can you do, or what other options do you have to help relieve some of the pain that you have? For mild pain, there are a few options that you have available that doesn't require you to use these NSAIDs, these over-the-counter pain medicines. Hot or cold packs or patches are, or sometimes a combination of the 2, can really help provide some relief from sore muscles and joints. Heat works by it relaxes the muscles, and it also dilates the blood vessel, so it allows more blood to reach the area of pain. And so this allows more oxygen and blood to reach the pain and reduce the sensation of pain. Cold works on the cold works a little bit differently, and it works by numbing the area and reduces inflammation. So any sort of if you have any sort of like swelling or injury that causes inflammation, cold is very helpful in that. It will help reduce that swelling, and you can. One of the nice things about this option is that you can easily find cold packs in your freezer. Like, and use a bag of frozen peas that are sitting in your freezer, or you can also use a washcloth soaked in cold water as well. For joint pain, there's also aspirin comes in a cream formulation, so and this is available through many different brand names. Aspiricream, Sports Cream, and Salon Pause are just a few common brand names of these pain medications. And since it's since you're applying on your skin, and since you're applying it on topically, you're applying it directly to the site of pain, and so it actually works quicker than if you take it by mouth. And so also help reduce the side effects and the potential toxicities or potential for damage or harm that comes to the kidneys. Let's talk talk about a few more. And then we have the camphor and menthol and capsaicin. These compounds are a little bit interesting. They're called what we call counter irritants, and they work by either producing a cooling or a sensation or a warming sensation. And you can think of them the way they work is if you hit your hand with a hammer, your thumb will hurt or your hand will hurt, right? And then you burn yourself on your other arm. What hurts more? So it kind of it takes away some of the sensation from one location to another, and so that's how these products work. Capsaicin, if you know, is the compound that's found in hot chili peppers. That's what makes them hot, and it's used to treat certain types, and it's excellent to treat certain types of neuralgia or nerve pain. And when you first apply it, it actually causes a warm, tingling feeling, but it'll get better over time. It'll take a few days to a couple weeks for it to actually kick into work. So that's one of the downsides of this capsaicin product. And this is available in a number of different brand names, including Zostrix and capsaicin. Now I've been talking a little about over-the-counter pain medicines. Another over-the-counter product that I just really want to briefly mention is heartburn medications. Now this heartburn medications have recently been linked to kidney disease, specifically to chronic kidney disease. And this has been just a more recent revelation just in the past couple of years, where there have been studies that have found that that there's a link between chronic use of these heartburn medications to kidney disease. Now, I believe as a pharmacist, and I know there's a lot of, there's been some other evidence out there as well that this is probably perhaps the most overprescribed medicine available out there. These are products that are not available over the counter, but these are products, these are medicines that you may frequently receive while you're hospitalized. And when you're in the hospital, you typically receive higher doses or prescription strength doses. So these are still available over the counter. So these particular heartburn medications, we call proton pump inhibitors. They're a specific type of heartburn medications. They've been found to increase the risk for kidney disease by about 20 to 50%. So the risk is significant with these medications, and there still needs to be, there's still some ongoing studies regarding to trying to figure out what the exact mechanism of how these heartburn medications cause kidney disease, but yes, these are definitely overused. One of the things that should be done with these heartburn medications is that if you're taking any of these, you should be talking to your doctor and asking them, should I be on it? Over 70% of these. It has been reported that over 70% of these medications have been prescribed or are being used inappropriately, and that about 25% of people who take these on a long-term basis can actually stop taking them, that there's no need for it. And so one thing you can do is, if you're taking any of these heartburn medications, is to ask your doctor, do I really need to be on this? Why am I on this? And that's the best way to see if you need to continue being on it, and if it's a possibility for you to stop taking it. Now for some general just considerations with over-the-counter pain medicines, and some things for you to just remember. You should avoid NSAIDs if you have kidney disease. If you're over age 60 or older, it's because the older population has a higher tendency, or is at higher risk of developing some of the side effects. And also, as we get older, our kidney function just naturally sort of declines, and so it puts us at an increased risk for developing some some of the harm from these NSAIDs. And of course, if you take any sort of blood pressure medications, this should be avoided as well. Drinking alcohol can also increase the risk of some of the side effects of these NSAIDs or these pain medicines, and so it should be avoided, including acetaminophen or Tylenol. Now, one tip that I like to always share is if you want to take NSAIDs, if that's the only medicine, over-the-counter pain medicine that will relieve your pain if you have any sort of inflammation, one thing you can do to reduce the side effects or potential harm with these medications is you can actually alternate using Tylenol one day or one dose, and then an NSAID like Advil or Motrin another dose. And by alternating these doses, you're reducing your exposure, how much of these medicines you're taking in. So it'll allow you to kind of get some pain relief from the pain without putting you at risk of developing some of the harmful effects of these medicines. You should also always take the smallest dose necessary for the shortest amount of time. This will minimize how much risk or how much you're exposed to these medicines. And you should also not take these NSAIDs or these pain medicines for any longer than 10 days. And this is clearly stated on the labels of these products. And of course, you should always talk to your healthcare provider as well. A lot of, as we get older, a lot of our ability to tolerate these medicines change. We develop conditions that may put us at higher risk of developing some of these some of these side effects, and so, or if we take other medicines, it could also increase the risk for developing some of these side effects. And so it is important to talk to your pharmacist or your physician, your other healthcare provider to make sure that it is safe for you to take. If you took ibuprofen or Motrin 20 years ago and it worked for you, don't assume that it's still the right medicine for you to take now, because conditions and situations change that may prevent you or put you at an increased risk from continuing to take these medicines. Now, before I wrap up, I'd like to add in a brief comment on safe medication disposal. Now, why is this important, and why should we really care? Well, there are a couple of reasons. First of all, in recent years, you may have heard all over the headlines, all over the news about the national epidemic that's going on with the opioid use and medications. And this epidemic is undoubtedly real. Drug overdose is now the #1 leading cause of accidental death in the United States, and it surpasses the deaths caused by car accidents. And here on this graph here, you can see that since 2002, these figures have been climbing from just a little over 20,000 deaths in 2002 to over 50,000 here in 2015. So these statistics is very alarming, and it's a real epidemic that's affecting all societies throughout the country. Here in Wisconsin, there's a statistic printed out that in 2013, 15% of Wisconsin high school students reported using a prescription drug without a prescription. Where do you think these high school students would obtain access to prescription medicines? A lot of times they're probably in your medicine cabinets at home. That's where they're able to first get access to these prescription medications. It starts with just the prescription pain medicines, and then it escalates up to stronger products, heroin, that can really become deadly to these youth. So it's a real problem, and there really needs to be some sort of concern. And this was just, I don't know if any of you are on Twitter, but this was a tweet that was posted by the Milwaukee County medical examiner, Dr. Brian Peterson, just a couple of days ago. Just pointed out a statistic that here in the month of October, so just we're day number 18 or 19 now, approximately every 16 hours in October there was somebody who died of a probable overdose here in the county of Milwaukee. And so it's a real problem, not just all over the country, but here at home, here in Milwaukee County. Now, if the opioid epidemic doesn't really hit you at home, maybe this will. There was a study that was published by the Associated Press back in 2008 that really that published a report that found that at least about 46 million Americans are supplied with water that has tested positive for trace amounts of pharmaceuticals. So these pharmaceuticals, these are medicines that include antibiotics, anti-seizure medications, cholesterol medications, even female hormones have been found in the water supply here in the U.S. And these drugs, how do these drugs end up in the waterways? Well, a couple of ways. We naturally excrete it through our bodies into the urine, but also these waterways sometimes serve as dumping grounds for these medicines. So people dump down their expired pain medicines or expired medicines down the toilet or the sink, and these enter the waterways, and it exposes everybody to these pharmaceuticals. Now, the good news is that here in Milwaukee, there's only, in this report that was published in 2008, there was only one trace product or pharmaceutical that was found in the waterways, and that was nicotine. So beyond a lot of floating cigarette butts in the water, they're probably, our water is probably relatively clean, at least it was 10 years ago. And so if you want to check out what drugs other cities have in their water supplies, there's an interactive map that you can use, and there's a link to the website at the bottom here that will show you. And I'll give you more information. So what exactly can you do to help? Yes?
You have down here that there is a take back on Saturday, October 28th. Where is that? I couldn't hear.
Yes, so I was coming to that. So, in terms of how you can safely dispose of your prescription medications or any medications that you have at home that are not being utilized, there are a number of ways you can do that. First and foremost, you should never flush or drain anything down the toilet. These can enter the water supplies. If you have any pain medicines, prescription strength pain medicines that are easily accessible, you should, I would consider locking them up, especially if you have youths or teenage around in the area who may come into easy access of it. And then when it comes to just a safe, other safe methods of disposal, here in Wisconsin, there's a drug day, take-back day event, and the Department of Justice sponsors this event. There's usually about 2 events a year, and so the next one is actually happening on next Saturday, October 28th. And if you, and this happens if you call your local police department or your local pharmacy, they will take back your medicines. Now, this map here, it has a location of all the sites within the state of Wisconsin that will take back your medicine. So you can go down to this website, or you can call your local pharmacy, your local police department, and ask if they're participating in this drug take-back event, and so see if you can take your medicines. And so that's probably the best way to go about it. And of course, if you need any more information, there are some pamphlets and some flyers in the back. If you haven't gotten a chance to see what's back there, I would encourage you. There's some great information that's put on, that's developed by the National Kidney Foundation about giving you more information about your kidneys, pain medicines, and some other important aspects of kidney disease. So that. If you have any more information, there's also contact National Kidney Foundation. They also have a great website and a phone number you can get a hold of them at. Otherwise, thank you, and I'll be happy to entertain any questions at this point. Yes?
Katherine, if you could repeat the questions too after some
Sure. Go ahead.
What's the story on some of these dyes they use for medical tests, like measurements on the heart and eyes and so forth? I understand those can cause serious kidney damage.
Correct. So if you're ever in a hospital or where you have to get these certain types of imaging type studies done, a lot of times they use what we call contrast dyes, which helps display more clearly on these images that are done exactly the picture that we're trying to get. But these dyes are actually are very harmful to the kidneys, and they reduce even a single dose can cause acute or injury, damage to the kidneys. And so if there's any sort of predisposition or a potential for, or if there's an increased risk, or we think that a patient has a higher risk for suffering from kidney damage, we will oftentimes not use that contrast or use those dyes in those specific types of imaging. And then you had a question.
Does it matter whether you take an over-the-counter medicine with food or not?
So the question was, does it matter whether you take the over-the-counter medicine with food or not? With the NSAIDs, we tell patients to take them with food, not because it has any sort of effect on the kidneys, but because it reduces the side effects with the bleeding risk or the ulcers. And so we tell patients to take these NSAIDs with food, just so that it reduces the risk for developing these bleeds in the stomach. But in terms of reducing the risk for kidney damage or reducing the risk for harm to the kidneys, there's no effect on that. Yes?
Could you go through the various stages of kidney failure and what symptoms those would be at each level?
Sure. I can go back to that slide.
You mentioned that normally you can't tell till you're at a serious level, but
yes.
any like subtle symptoms you've noticed?
So most people, especially if they're in the early stages of kidney disease, it's not something that you will be able to identify. It's not something that you will have symptoms. And the best way to determine that is if you have these tests done, these urine tests or these blood tests. That'll tell you if you have any sort of kidney damage. We start getting concerned with kidney disease once you start getting to stage 3 and 4 or lower, and it's at this point where symptoms may become a little bit more apparent, and becomes a little bit more of a concern. What we try to do with our patients is once kidney disease is developed, particularly if it's detected early on, is to take measures to reduce the progression or prevent the progression of the disease from occurring. And so it's very important that if you're at risk or there's suspicion that you have some sort of kidney disease, that you are tested, because once you're tested, we can take measures to reduce or prevent the progression of the disease. Because once kidney disease progresses, it's not reversible. You cannot regain function of your kidneys.
Can you stop the progression?
You can
stay at whatever.
Yes, so you can stop the progression. So if you say if you get to stage 3, and that's when you first detect that you have kidney disease, you can take measures to reduce or prevent the progression of that disease, to stop it. So you may stay at a 3, so you don't get to stage 4, stage 5. Yes, you can most certainly do that, and that's one of the reasons why we recommend or highly encourage that people get tested for kidney function.
It's good to look on your lab report at that GFR.
The GFR, yep.
Supposed to be picked up on GFR. So on the bottom of your lab report, if you get blood taken at the doctor,
Yes.
That'll show up. So that's the measure of how your kidneys are
Yes.
filtering.
So yes. So it's a very common test, and so if you ever have a blood test, it's usually reported along with that. So yes.
Several questions. So once you get to stage 3 then and later, what happens with pain relievers then? Do you recommend people not use them, or you use the...
Sure. So the question was, once you get to stage 3 or later, do you recommend not using these pain relievers? And yes, I would not recommend using these NSAID pain relievers, particularly as remember, like once kidney disease develops, you want to make sure that you maintain whatever kidney function you have left. You want to take every measure to avoid progressing to stage 4 or stage 5. And the best way to do this is to avoid every kind of risk or any risk that may potentially damage your kidneys or harm your kidneys. Yes.
So you mentioned the baby aspirin before, which is a common thing for diabetics to take, even though that's one of the most common causes of kidney disease. I mean, does a little bit have a little effect or no effect? I mean, is it better to have none, or the small doses are insignificant?
So just to clarify, baby aspirin doses are safe to take, and the benefits of taking baby aspirin, it greatly outweighs or has very, it should be recommended that you continue taking them. The risk it has on developing kidney disease is very minimal. When we start getting concerned is when you start taking these higher doses of aspirin, the doses that actually relieve the pain. And so if you're taking baby aspirin, I would not be concerned with the effects that it has on your kidneys. Yes.
The chart on page 4 where you listed the 3 enzymes and 1 side by side.
Yes, I'll bring that up.
You were talking about the dosage every 4 hours versus 4 to 6 versus every 8 to 12. And then looking at that, I see the milligrams are about the same, but the tablets are the difference with that. So is there less risk for taking fewer of the tablets, like less risk with Aleve or Naproxen versus the other one?
So the question was, with these different doses of medicines, with the ibuprofen you take maybe 4 to 6 hours, with the naproxen you take every 8 to 12 hours. Do the difference in the doses that you take on a daily basis have different effects on how on your kidneys? And the answer is no. The maximum doses are based on they're not equivalent, so they're not comparing apples to apples. So they're different ingredients. So the maximum dose of naproxen, although it's dosed twice a day, is based on its its safety and efficacy. So whenever we give these maximum doses, they're based on studies that show this is like the maximum safe dose to use. And then with ibuprofen, it's a different dose. It's a different drug, so there'll be different maximum doses. But you cannot compare them one-on-one together, and so you cannot say that because you're getting a smaller dose with Aleve that you're at lower risk of developing kidney disease, because you're not comparing the same thing. Any other questions? Do I have any questions online? Okay, one more question.
I wondered about the medication disposal, and if you could talk about water filtration devices like reverse osmosis, would that get rid of some of the pharmaceuticals? Is there like a percentage that you're looking for?
So I'm not 100% sure about the how much of these different water purification systems will remove these pharmaceutical products. It's something to kind of look into the particular system that you're using to see what they report as to like how small of a molecule or how small of a particle that they're able to remove from these systems, because they'll be they'll vary different depending on the type of water system you use. Yes.
Is there any special exercises you can do to help kidneys?
Is there any special exercises that you can do to help with your kidneys? Drink water. Stay hydrated. If you stay hydrated, you're able to maintain that blood flow to the kidneys, and make sure that it's getting enough oxygen and maintaining its health. But everything else, I would just say, just if you have any sort of like conditions that puts you at risk for developing kidney disease, like diabetes or high blood pressure, just make sure that you're able to control those conditions. Those will be the highest. Those will be the primary reasons why anybody develops kidney disease.
But people can also come to the kidney walk on May 5th if they want to exercise.
Yeah. Yes.
I'm taking Tylenol right now because I was taking ibuprofen and my creatinine level was
Going up. Yep.
Yeah, but I stopped it. The Governec, it's gone down. But now I'm on Tylenol, and the doctor says, no, don't take any more than 3,000 milligrams a day. And I know my pharmacist that I go to, she says 4,000 milligrams. That says 4,000 milligrams. And also the bottle says 4,000 milligrams, but the doctor says 3. So is it because of my age, or why?
So up until I think in 2011, the FDA made some changes to how they recommend, or how much Tylenol that they recommend manufacturers report, for the maximum dose of Tylenol. Traditionally, it's always been 4,000 milligrams per day, but there had been increased reports of liver damage or liver disease, and this has been due to higher consumption of Tylenol, higher intake of Tylenol, and this comes not only from just the daily Tylenol, but I also mentioned a lot of prescription pain medicines also contain Tylenol, and so it's just one of the ways that one of the measures that they implemented to help reduce how much Tylenol is being taken to reduce this.
I'm taking it every day and for long periods of time because of severe arthritis.
Yes. So with the lower recommendation is just meant to help reduce the potential for liver damage, but usually we don't get concerned with liver damage until you exceed this 4,000 milligrams per day, and the lower dose is just recommended just in case you accidentally take an over-the-counter product that has acetaminophen, so you don't, so you're not just pushing yourself over the limit.
I can go to 4,000, but if you can get by with 3,000 a day, it's better.
Yeah. So if you can use this, so the just the, I guess the rule of thumb here is if you just use the smallest dose that you will relieve your pain. That's the best dose to use.
Any other questions for Katherine?
All right.
Katherine, we appreciate you being.
Oh, one more question.
Okay, I just came. You know, sometimes the advice that you get from a doctor is very different than what we get in my college.
Yeah.
Than what we would hear from a pharmacist. And so I guess, like, there's one doctor I know that says, well, as long as you're taking it according to the directions on the prescription, or the over-the-counter, as long as it's on the bottle or box, you're probably not going to take too much that it's going to be affecting your kidneys. Is that with an average person, or, you know, how would you?
So there's a lot of factors that come into when it comes to the risk for kidney damage. So if your doctor says just take it according to instructions without regards to your personal medical history, I think it's a wrong game to play, really. You really need to take into consideration the specific conditions that are in place. So if you have any sort of conditions that put you at an increased risk for developing kidney disease, it should not be just a one dose or one dose fits all type of situation.
Would it be more of a personal medical history, or even family, like if you have a parent?
It would be a personal medical history, yes.
So once you develop those things, that's when you need to start watching how much you're taking.
Right.
Okay, thank you.
All right, I just want to remind everybody, I want to thank people that were online. I want to remind you, if you didn't check in with me, I just need to check you off, but if you could give us some feedback on your evaluation form before you leave tonight. So thank you all for coming, and a special thank you to Katherine for volunteering tonight. I thought she gave us a lot of very useful information. Do your homework now. All right, you guys want to do your evaluation? All right, then you're off the hook. Good to see you. Thank you. Thank you so much for coming.